and the emergency manager for Fannin Regional Hospital up in Blue Ridge. We're going to talk about HIPAA. Sorry, I'm ahead of myself. We're going to talk about HIPAA. Anybody tell me what HIPAA is? I'm sorry, one more time.
Health information portability or something.
You're close. Who else? It's not an animal from Africa either.
I said it was a large animal from Africa.
No, that's the government that created HIPAA.
Oh, okay.
Okay, so anyway, this is me. I'm a nurse. I've been a nurse for going on 14 years. I was a paramedic for 20 years. I've been a firefighter. I've been a police officer. You know, it's what I do. Right now I'm the Director of Emergency Services at Fannin Regional Hospital. We're a 50-bed rural hospital up in the North Georgia mountains. If you've never been there, come on up. My call sign is KM4HDS. Anybody has any questions? So, HIPAA is the Health Information Portability and Accountability Act. First came out in 1996. The part of it that we are concerned about is the part of privacy. It provides the standards for protection of your patients' protected health information. So this is your medical records, your financial records from the hospital, things like that. So what is PHI, or protected health information? Anything written, verbal, or electronic. Includes emails, cell phones, text messages, anything like that. It's the stuff that we're going to do in an emergency. So like we already talked about, names, addresses, social security numbers, medical records or account numbers, telephone numbers, anything about their condition, any treatments they've had for past, present, or possible conditions, billing and payment records. These are the things you need to ask yourself before you send information or use information. Don't even have to send anything, just using it. Is it really necessary for you to do your job? Are you accessing only the minimum amount of information that you need? Are you disclosing information that's protected? And are you accessing, using, or disclosing information that you should have an authorization from? That part you don't have to worry about. When's it okay to share PHI? Again, and you'll see this repetitively because this is how we make folks understand, is you only need the minimum amount of information to finish your job. I'm sorry, was there a question? Did I see something? Okay. You're only going to share those who have a need to know, clinical or business-wise. And then only the amount of PHI that is requested. So you're never going to have somebody ask for an entire, or you're never going to send an entire medical record. And granted, in an emergency situation, we're not going to do that anyway. Okay, here's some examples. Billing clerk may need to know what lab test was done, but they have no need to know what the result is. Admissions clerk doesn't need to have access to the record to do their job. And a transporter doesn't need that. They may have the record with them, but they have no reason other than to know who the patient is, be able to identify that patient, and take them to wherever they need to go. Here's a big problem in hospitals. Especially, this has never been a problem at our facility, but it has a potential. Blue Ridge is a tourist area. We have a lot of high-profile people who have mountain homes. They do come to the hospital. We have people that come up that are high-profile that stay in the cabins up there. So accessing medical records for families, celebrities, neighbors, not verifying the authority of the individual receiving it, inappropriate use of technology, camera phones, no. And you will see stuff posted in facilities that says, you know, photographing is not allowed in this area. Texting, social networking, we've had folks do things and put stuff up on social networking, thought they were joking around. It didn't have any real PHI, but they were doing stuff that really wasn't appropriate to be put out in social networking. And then employees who go in there and do things that are outside their scope. Are you a criminal? Well, if you violate HIPAA, potentially you could be. If you choose not to comply, it could result in civil and criminal penalties. If you obtain or disclose without a proper authority, you may face fines up to $50,000 and a year in jail. That makes you a felon. PHI with the intent to sell, $250,000 in 10 years. So you could be working here at Gypstick if you want to do this. So what's the difference between disclosure and use? Depends on who it's going to. That's what makes the difference between disclosure and use. Use is sharing it within the facility. Disclosure is if it goes outside the facility. What is a breach? This is the word that no facility privacy officer wants to hear. Access or use of disclosure that was unauthorized and a PHI that was maintained on behalf of, by or on behalf of a person. Does not include unintentional acquisition, disclosure made in good faith, within the course and scope of your job. In other words, just looking someone's PHI up, if you didn't print it or tell someone, is still a breach. And with our facility and pretty much every facility, disciplinary action up to and including termination. Usually it's at least a written write-up and some time off if we don't terminate you. Other forms of breach, texting information. The only way information can be texted is texted, that's not a word. The only way you can text information regarding a patient is using a secure text messaging application. We use an application called Tiger Text in our facility. That's the only way you can send PHI. Taking pictures is a no-no. Posting information on Facebook about a patient, even when you don't get the patient's name, is a no-no. If it wasn't on here, it wouldn't have been done before. So guess what? So what happens? The incident must immediately be reported to the facility privacy officer. Every facility has one of these, and this is their responsibility. They have to determine if the information meets the definition of a breach, and then what the risk of harm is. It causes big issues. Sometimes you have to notify the patient, sometimes you don't. Sometimes we have to notify HHS. If it's posted in the local media, the facility can get fined, and so can the individual. In just a few minutes, I'm going to show you what some examples of those fines are. You really don't want to do it. So incidental uses and disclosures. If they call you from the waiting room and use your name, that's an incidental disclosure and is not a breach. Not a violation if reasonable safeguards and implemented minimum necessary standard. Discussion during teaching rounds. So if you have a group of nursing students or a group of residents and they're discussing cases and you happen to walk by and hear that Miss Sally Jones has a tumor, well, okay, that's incidental. Call a patient out of the waiting room. Sign-in sheets. Everybody gets concerned about sign-in sheets. That's not a breach. So how are we going to protect their privacy?
One question.
Yes, sir.
Sign-in sheets. I'm assuming that it would be a breach if someone took those sign-in sheets outside of the facility and shared them with.
Yes, but that's why, if you'll notice, most sign-in sheets, they have a place to sign, and then they peel them off, and they take them to the back. Matter of fact, I don't think I've seen anybody anymore that doesn't use those. But yes, that would be a breach. Exactly. So,
I've always wondered, why does it trouble them?
I thought it was called the ladies.
Yeah.
that too. All right, so for the clinical folks, you're going to close curtains, you speak softly when discussing treatments. You make sure you log off your computer. I have to beat my folks on a daily basis for not logging off. If you stay logged on, it may not be your screen that's up there, but in the background, that's your login that's up there. You make sure you don't throw patient labels in the trash. And this is, again, stuff that the clinical folks need to worry about. This is not stuff that we would have to be dealing with on a regular basis. Clear patient off your desk and in a secure location when not in use. If you go by a nurse's station, you will see that the top of those counters and everything are usually kept pretty clean. There shouldn't be anything with patient information up there. Now, it may be behind it, but it's usually upside down, and that's why, because they're trying to make sure they're meeting their HIPAA requirements. And then we make sure we verify fax numbers and addresses before we send stuff out. They say that's never happened before. I'm sorry?
Can I ask you questions? We were talking earlier about logs for 309s.
Okay.
And we're talking about, you make one and you turn it into the hospital. That make one for us. And technically, some of the information we can have in the logs can be protected information.
There shouldn't be any patient information on that log.
Yeah, but if it identifies the hospital, and it talks about a specific case or specific circumstances, even though there's no mention of names, but if potentially in a small community, that person could be identified, that's considered.
That would be a facility privacy officer question, and she or he would need to review that data before it's sent out or before it leaves.
What I'm talking about is the law.
No, I understand that. Before anything is done with that, though, they would need to be reviewed by the facility privacy officer to see if that is appropriate for them to leave that location. Guys, ladies, they are sticklers about this. I am telling you, I live this every day. All right, so we don't discuss patient in public areas, so you should not be hearing staff discuss stuff in elevators, at the lunchroom, or whatever. You never share your computer name, username, ID, and password. So let's stop for a second. I understand there was some concern. I was just listening after the last class, and people were talking about information in computers. And I think this morning when Brett, it's like, why don't we have computers in the hospital for the operators? Here's why. Mainly because of this. If we start giving everybody a log on, while we can restrict part of their access, they still have a log on. It creates problems for privacy if more people than have access than really truly need it. That's why we would ask that you bring your laptop with you, and because I guarantee you that because we don't always know what operator we'll get, and I don't have generic log-ons. And my IT director and my FPO are not going to do that every time we have a disaster. Yes, sir.
I have my consultant here next to me. You kind of hit on a sore point for me.
Okay.
And I get it. Believe me, I get it. I work for AT&T and security. I get it. You just said, if I were to be an operator at your facility, if I'm mistaken, correct me,
Okay.
you would prefer me to bring my own laptop
Because,
to my operations to carry out my duties in the facility. I get it. However, number one, it's mine, it costs money, and I'm going to need to hit your printer to be able to print something and all this other stuff. If we're having discussions about, as hospital operators, I expect my hospital to provide me, it doesn't have to be on your corporate network.
it has to be. There's no, so let me, this is,
This is directly opposite of what I'm told.
it's a huge issue because these facilities have, without going into the networking and all that stuff that goes with that, it's painful. I mean, to give everybody an access and then have to turn around and control what access they have, and it just brings up a huge can of worms.
What about standalone computers?
I'm sorry?
What about standalone, not hooked up to their LAN at all, just a discrete computer for the radio station alone?
Again, you still have to log on to the network.
Just Wi-Fi. No more than difference in this, not like.
If you need access to the
Why should, as opposed to, instead of bringing my equipment, have their equipment that's not.
Right, no, I understand, and that could work, And again, what we have to make sure is, do you need network access, or can you do it off the Wi-Fi? And I will tell you that if we start having Wi-Fi problems, the first thing that my IT director is going to drop is that public access Wi-Fi.
We've asked for an IP address outside the firewall to us.
You haven't met my IT director. Go ahead. Yes, sir. Hang on. Steve?
Back in Savannah, we have one computer. It's actually in my name.
Uh-huh.
It belongs to the hospital. It's
Okay.
their side of the firewalls. And we have a common password so everybody knows.
Okay, so,
We only have one computer in my name that we use.
okay. So, and I hear exactly what you're saying, and that could work. And this is why each facility needs to have a plan on how they want to do that. Because I'm speaking in generalities and what IT and the facility privacy officer are going to want to do. And they're going to want to try and protect the facility. In saying that, if they come up with a plan that they're comfortable with, go for it. Yes, sir.
Would it be, going back to us bringing our own equipment in there,
Okay.
wouldn't we have to log on to your network to use your printer?
That's again, there's the problem.
Unless there was a standalone
Right.
printer that we.
And that all needs to be worked out with the EM, the FPO, the IT folks, and that's why you have to have a plan before the incident happens.
So a follow-up to that would it be feasible or even helpful if what you do at your hospital to solve that problem and what they do at their hospital to solve that problem?
Sure, that's great.
Shared so that when we go to our person and go, we need a laptop and we need a printer, here are some suggestions from other facilities.
Right.
Would that work here? That might give the IT guy or the administrator or the HIPAA man
Okay. Absolutely.
potential solution.
Absolutely. It's a communication and coordination thing, and this is where the hospitals have not succeeded or excelled. Is first of all, they don't talk to each other, and unless they're within the same health system, and that's where we all need to come together. Yes, sir.
You're going to get that ball rolling.
Hey, that's why we're all here. So we can take those ideas back to our facilities, and and that's where your section folks and that's where they all need to be talking to their EMs. Yes, sir.
We just learned in Winley to use the internet when possible.
Right.
Instead of radio frequency.
Right?
But yet, we can't get into your internet because we're locked out of it. Am I correct?
No, because there's the public side,
Okay.
and then there's the private side. Again, that's a discussion that has to be had beforehand with the IT and facility privacy folks to decide that, okay, I've lost my internet or part of my internet. I'm going to drop, this is the IT director, I'm going to drop the public side so I can pull more bandwidth for my internal operation. So if they do that and you're on the public side, you can no longer send your mission out or your messages out. That's why we have to have that taken care of beforehand of how we're going to handle that. So we don't want to be looking at information on patients unless we're need it to do our jobs. Take information home. Discuss patient information in front of visitors or without explicit documented authorization from patients. Post any patient-related information anywhere. And then finally, bring friends and family into areas of the facility that they don't need to be in. All right, so we don't share PHI with our family and friends, period. If you don't believe me, ask my wife, and she's sitting on the front row. She knows nothing. She goes, such and such said such and such and such and such. You didn't even tell me. Yeah. And how long have we been married? If you have to share information, you have to have consent. You have to document that patient's decision. And sometimes you don't want to necessarily disclose stuff. Let the patient do it. Again, a lot of this is clinical stuff that is not necessarily in our realm. Friends and family, you don't get to send information on them home, whether it's your child or whatever. We don't get to go open their charts and look at them. That will get you terminated. You can't look at your own records. That will get you terminated. We don't have the right to access patient employees' PHI in the role of the employer. So if I have a nurse that has a procedure, I can't go look at her to decide whether or not she can work or not. If a nurse comes down there to be seen in the emergency department because they got hurt on the job or whatever, the supervisor can't come down and open up and look at their chart. That's what we call the FPO if we have a question. I have this laptop, it has PHI on it. My FPO knows I have it. I need it because I have to do work from home, otherwise I'd spend my entire life in my office. But it's also encrypted, and somebody asked me for a copy of this PowerPoint presentation. I said, I'll be glad to give it to you, but as soon as I do, your thumb drive is going to be encrypted. If I put something in there, it automatically, it's because it's set up through corporate, that any outside drives automatically get encrypted. I have like 6 drives that are encrypted. So potential HIPAA violations. Text messaging. I hate text messages. Employee passing information on to her son about his spouse and children. Oh, no. Former employees in off-limits areas, including children. I have had registration folks I've had to send out of the area because they brought their kids to work. Taking pictures, and a lot of this we've already talked about. Releasing information to callers. Sending PHI to the wrong person. Looking at PHI of family, friends, and coworkers. Posting information. Social networking is just there are no excuses. I need to let mama know he was okay. Nope, that doesn't hold water. She's my best friend and she wouldn't mind me looking? Nope. Nosiness, ain't nobody like that, right? So, I'm sorry, yes sir?
So I understand a medical professional or somebody working at the hospital doesn't take photos of patients. What about patients taking photos with you in them? That, I guess, would be allowed.
That's why we have signs up that say no photos allowed, no photographing the area to keep stuff like that happening. I mean, can I make you not do it? No, I can't, but we try to strongly discourage that. Well, I'm ugly enough as it is.
It's like I remember when I gave my kids were born.
Sure.
I was in there with a camera.
Right. There are incidents that's because it's been approved beforehand, but because some guy put a nail through his hand and somebody wants to come take a picture, oh, that's cool. You can't do that.
Put a nail in your own hand, take it.
Now there are times that we do that, but again, it's done through a secure means, because we'll have injuries that the physician will take a picture of it and then send it to the surgeon, so the surgeon can go, yeah, I can deal with that, or no, I won't deal with that. Yes, sir.
Earlier we were talking about the security of the internet or transmission. We're talking about to transmit some HIPAA protected information. And basically, means it's not secure. Is that going to be an issue?
It's going to be very difficult, and that's why there has to be a plan in place on what the FPO is going to consider protected and what's not. And reviewing logs and messages before they go out, specifically for that reason, because it's unsecured. You cannot encrypt whatever you're sending out.
But I can't foresee it being a lot of,
It's a hard place to be at. So the corporate compliance and privacy officer, this stuff goes all the way up, and you'll see why in just a minute. And then there's a hotline that is used to, if we have a disclosure. It's kind of like a whistleblower's line.
Yeah, but you can't tell them anything because you'd be disclosing information.
No, but they can come and find out. They can go, hey, we had a potential breach. We want to know about this. All right, state and federal laws protect protect folks for non-retaliate. I can't talk. Too low. Non-retaliation. It's polysyllabic, so I couldn't do it. It's if you think there's going to be a breach, then you have an obligation to say something. Even though you're not an employee of the hospital, if you are working for them in a capacity as an operator, then you are covered under this, and you have an obligation, you have a concern.
Okay, make sure you repeat that. That's very, very important.
It is your, and I'm going to read it off the screen here. It is your duty and responsibility to report inappropriate use, access, or disclosure of PHI to the facility privacy officer, the corporate compliance and privacy officer, or the confidential disclosure program hotline. If you think you're fixing to do something you ain't supposed to, don't do it. Okay? Because ultimately, if you send it, you're responsible. Along with whoever gave it to you, because there's going to be a whole bunch of bodies, and they're going to be stacking them.
Let me ask you one more question.
Yes, sir.
So, I understand if it's about a person, but if the hospital is requesting from another hospital batches of type of medicine, that's
fine.
That's not personal.
That's not, no.
Or if there's an earthquake and they have 10 casualties, that's not HIPAA, right?
Correct. I mean, that's very vague, and whatever, you know, it is what it is. So it's mandatory that we comply because it's part of our culture. Compliance is part of your job, and when you're there working, then it's part of your job. Non-compliance, we already talked about disciplinary action, and then civil and criminal penalties. Facility protects patient privacy by what we've already talked about, assign a facility privacy officer. We have written policies and procedures. We are required to have yearly HIPAA training. We do our best to protect health information, providing discipline to those who don't, and give our patients notice of how we're going to use their PHI. This is all what the privacy practices are. They're always available as a paper copy on the website and posted in the facility. So we can give information out, but we have to have an authorization from the patient. Yes, sir.
Should ARES have a special authorization that we can have to sign when we have an emergency that we actually need to communicate patient information?
That will be what's determined by your facility privacy officer, the IT, and the administration.
That doesn't necessarily give us individual ARES operators some sort of uniform protection. I'm just wondering if we ought to have our own thing, because we can not transmit if we don't think we get
every facility is going to be different. Every facility is going to handle their stuff the same, how they're going to handle it. Our facility is going to handle it differently than Union General Hospital in Blairsville or Piedmont Mountainside in Jasper. Piedmont's going to have a different way of dealing with that than Northside does. I mean, you're talking about two different health systems. It's just going to be up to how they want to handle that. It needs to be approached, or it needs to be broached by the facility. And y'all as operators need to make sure y'all take that back, either through like Brett's counterpart or whoever is in your next higher up. Yes, sir.
Well, what we said before is if they bring you documents and they want it submitted, they want it sent somewhere, and you look at it and you believe that it contains PHI, patient protected health information, then stop. Ask to see a privacy officer and have them verify that it does not include PHI.
No, my question was, we could easily potentially be in a little emergency situation where transmitting PHI is a life and death matter for a patient.
No, it won't be. No. You will not be in that situation. If it's that dire, they will make a decision before it ever gets to you. Honestly.
No, my point is that maybe we have to have a safe harbor where we have, if they want us to transmit that kind of information, then we got to have a sign-off sheet.
Well, this is, even satellite's not secure.
I know, it's completely.
So, I mean, this is, because we're not talking about just local stuff, this is a federal law. So the government's got to get involved, and they're the ones who have to make a final call on that. But it's up to your FPO to decide whether or not the information that you send is at PHI and it's okay to send it.
So fundamentally, in short, if I am show up and they give me something I think is PHI, I can either say I need written consent from.
You need someone to review this and authorize it.
To sign this, I need some piece of shit that says I'm allowed.
However you want it.
I ain't doing it.
Right, and you are within your rights to do that. Because if you notice the last line of this, only certain staff members are permitted to accept and act upon patient authorizations. Now there's stuff by federal law, but this is not stuff that you're going to transmit because you're not going to talk about workers' comp and all the rest of this. This is opting out. The patient has that right. But again, we're talking about stuff that's not going to be going on during a time when y'all would be operating. So case study, Sally housekeeper noticed her neighbor Penny patient walking down the hall in a Hospital gown pushed an IV pole, went home later and told her husband she saw her on the cancer unit. HIPAA violation, yes or no? Penny patient's waiting in the outpatient clinic. Nurse Jones calls her and calls out. Penny patient. So is that a HIPAA violation? No. All right. So we're going to talk about her taking her Wellbutrin for her depression while they're walking back to the office. Is that a HIPAA violation? Nurse Jane sees Nurse Sue looking in records, not the caregiver. What should Nurse Jane do? And say, hey, you really should stop doing that. So become privacy focused, know the privacy policies, understand how important it is. Make sure you're sensitive to the patient's privacy needs. Again, a lot of this is clinical stuff, but you wouldn't want your information out there. So let's make sure that none of our patients are. And they're your patients too. If you're out there working, hey, these folks are your patients too. Tag, you're it. Yes, sir.
So privacy is important, right?
Yes, sir.
Privacy is important. I mean, this is being nice to people, right? You don't want to go sharing people's information, right? But treatment is not breach. Okay, every day when I see a patient in the pickup area,
right,
and I need records from their previous hospital,
sure,
I have them scratch their signature on a piece of paper,
right,
and I give it to a secretary.
Right.
Without demanding anything, she faxes it to the referring hospital.
Right.
The referring hospital looks at the piece of paper, looks at the signature, has a date of birth.
That's correct.
They accept it, they hand to their secretary protected health information and send it over an insecure fax back to my secretary who hands it to me. That's treatment. We're trying to take care of patients.
Well, they have deemed the fax lines, as long as the numbers have been verified that it's one fax to another fax and that you know where that fax is or going, that's deemed protected.
Treatment is different from breach. Treatment is trying to do the right things, the right place, the right way. I'm looking at a document from DHS that explains in Katrina, yes, you can send information about patients for treatment, okay? When you're asked to provide information for a life or death situation to another treating facility, that's treatment.
So, I'm going to go back to what I said before. As an operator, you need to determine with the facility that you're at what they're willing to send and what they're not to send, because at some point it's going to be their choice or their determination. So, and there you go. There's your answer.
But you may not do any good for a patient who's dying. If you're in a situation where 400 people need to be evacuated from a hospital and you refuse to help,
I mean, I can see someone saying, okay, we need X medicine for X disease now, as opposed to we need James Reeves to get Valium because he's going crazy.
So your first thing is covered because you're not
giving out names, you're not giving out specifics.
Your second one, they're going to make that determination without.
I agree that James Reeves is going crazy. They're going to give me all the Valium I need.
no, what he's saying is that will never get to you, the same.
That's not going to be an issue that you see.
It could.
There could be shoulda, coulda, wouldas all day long, and we could beat that to death. But in the end, it's going to be up to your incident command and that facility privacy officer to decide what they're going to do and deal with the consequences after the fact.
Make sure their signatures on the document.
You've answered your own question. So, got to be serious about the privacy. All these complaints are taken seriously. They will investigate them. Employees who violate, disciplinary action, like I said, it's going to be repeated and beat into the ground. And retaliation against anybody reporting will not be tolerated. So what can happen if you violate it? Fines range from $50,000 to $250,000, up to 10 years in jail, civil suits, and then violation of policy, again, termination. So this is how it's broken down. It's broken into tiers. So tier 1 is the covered entity did not know and could not reasonably have known of the breach. That would be like if somebody stuck something in their pocket, took them home. It can happen. up to 4th tier, which they knew about it and chose not to do anything about it. These are the settlement fines for 2017, some of them. So Memorial Healthcare System, $5.5 million. $475,000. The lowest one was $31,000. We're not talking about chump change. In today's environment, if it's a rural healthcare facility, it can break them. I mean, we're talking about some of these folks, this is 2 years worth of gross revenue. These are some more examples. This is a Cleveland Clinic case. The individual who did it, 87 months in prison, 3 years of supervised release, and restitution of $2.5 million. See, where's here's Octomom's records. The facility got fined $250,000, and a whole bunch of people got in trouble. 22-year-old woman sent a year in prison for illegally accessing and then putting stuff on MySpace because she had the high five. Confidentiality is everybody's job, including ours. Privacy matters. And guys, don't take this casually. Okay, I'm telling you, these facilities do not play when it comes to privacy stuff. Could be your health. Anybody have any questions? Once, twice, 3 times. Good dialogue. I know it's tough because it's a gray area, but if all else fails, put it back on the facility because it's their responsibility. Thanks, everybody. Have a safe trip home.